Most people have experienced some sleep deprivation. Make it personal and frightening immediately. What would happen to your brain if you stayed awake for 72 hours straight? The answer involves hallucinations, paranoia, organ failure, and in extreme cases, death. Today, we go inside the human brain, hour by hour, to show you exactly what sleep deprivation does at the cellular, neural, and whole body level. Warning: what you are about to see will change the way you think about sleep forever. The moment you decide to stay awake past your normal sleep time, the damage begins. Adenosine, the sleep pressure molecule, has been building in your brain all day. By hour 16 without sleep, your adenosine levels are overwhelming your alertness systems. After 17 hours without sleep, cognitive performance drops to the equivalent of a blood alcohol content of 0.05%. The prefrontal cortex, your decision-making, impulse control, and rational thinking center, is the first region to suffer. Simultaneously, the amygdala becomes 60% more reactive. Small frustrations feel catastrophic. Your emotional regulation is collapsing. Your brain is trying to compensate, flooding certain regions with norepinephrine and dopamine to maintain alertness. But this chemical rescue is unsustainable. By hour 24, microsleeps begin. Your brain forces itself into brief 1 to 15-second sleep episodes, even when your eyes are open. After 24 hours without sleep, the body's systems begin failing in a specific order. The immune system begins to collapse. Natural killer cell activity drops by 70% after one sleepless night. Inflammatory cytokines flood the bloodstream, causing the familiar aches and heaviness of sleep deprivation, identical to the early stages of infection. Your pain threshold drops dramatically. Ordinary sensations become uncomfortable, and existing pain intensifies significantly. Metabolic disruption accelerates. Insulin sensitivity drops. Appetite hormones go haywire. Ghrelin surges and leptin crashes, driving intense cravings for high-calorie foods. By hour 36, the glymphatic system has accumulated 36 hours of toxic waste in the brain. Amyloid beta and tau proteins are accumulating at accelerating rates. At 36 hours, the first hallucinations can begin. Visual cortex neurons are so destabilized they begin generating images without external input. After 48 hours, perceptual distortions become severe. Sounds may appear visual. Stationary objects appear to move. Reality testing is severely compromised. Beyond 48 hours, the brain begins exhibiting symptoms indistinguishable from acute psychosis. Paranoid ideation, a sense that people are watching, plotting, or threatening, emerges as the amygdala generates threat signals without rational correction. The cerebellum, normally maintaining balance and coordination, shows progressive dysfunction, causing stumbling, tremors, and loss of fine motor control. The cardiovascular system is under extreme stress. Heart rate variability, a key measure of cardiac health, collapses. Blood pressure becomes erratic. Cortisol levels reach crisis levels. Continuously elevated stress hormone is now actively breaking down muscle tissue and bone density. By hour 72, the brain has lost the ability to distinguish between what is real and what is not. Now, the question everyone wants answered. If you finally sleep, how quickly does the brain and body recover? The brain immediately prioritizes deep sleep, generating the largest slow waves ever recorded, in a desperate attempt to clear the accumulated toxic backlog. Within the first recovery sleep, the immune system begins rebuilding. Natural killer cell populations start recovering within 24 hours of resumed sleep. Cognitive function, particularly working memory and attention, recovers significantly after one full recovery night, but complete recovery takes several days. However, not all damage reverses immediately. Some inflammatory markers remain elevated for days. Certain cognitive deficits persist for up to a week. And here is the most alarming finding. Some of the glymphatic damage from 72-hour deprivation may not fully reverse, particularly the accumulation of amyloid precursor proteins. Most people will never stay awake for 72 hours, but millions are chronically depriving themselves of sleep every single night. Getting 6 hours per night for 2 weeks produces the same cognitive impairment as 48 hours of total sleep deprivation, but you will feel only mildly sleepy. This is the most dangerous aspect of chronic sleep deprivation. You lose the ability to accurately judge how impaired you are. The single most powerful thing you can do for your brain health, more than any supplement, drug, or intervention, is consistently getting 7 to 9 hours of sleep. A consistent sleep schedule, waking at the same time every morning, is the foundation of brain health, immune function, metabolic regulation, and longevity. Sleep is not a luxury. It is the biological process upon which every other function of your brain and body depends.